We found that hyperglycemia is associated with postoperative lower extremity weakness after endovascular repair of complex aortic aneurysms. And based on that finding, we initiated an insulin infusion protocol in all patients undergoing this complex surgery to maintain their blood glucose levels less than 120 milligrams per deciliter. And after initiation of that insulin infusion protocol, we found a drastic decrease in the rate of postoperative lower extremity weakness. There's been a lot of data suggesting that hyperglycemia is associated with worsened clinical outcomes after stroke, but not much work has been done in the setting of spinal cord ischemia. There have been animal studies that suggest that hyperglycemia is associated with worsened spinal cord injury in animals, and that normalizing the glucose levels will actually mitigate against some of those adverse effects. So after we found that hyperglycemia was associated with an increased risk of spinal cord injury after endovascular aortic aneurysm repair, we initiated this insulin infusion protocol and did find a dramatic decrease in the rate of lower extremity weakness. We very carefully studied it in the multi-branched endovascular aortic aneurysm repair patients, just because they're a homogeneous group of patients, and the procedure has been pretty much protocolized at our institution. However, based on our findings, I've actually extrapolated, and I now place all of my patients who undergo a TVAR or any extensive aortic procedure on an insulin drip for the first 24 to 48 hours after the procedure. Well, it could be a couple of things. It could be that high glucose levels are just toxic to these cells, and by normalizing glucose levels, we're seeing the protective effects of euglycemia. On the other hand, insulin has many pleiotropic effects, kind of like a statin. There are a lot of insulin receptors across the central nervous system, and insulin acts in many different ways. It can help to prevent disruption of the blood-brain barrier. It may act as a vasodilator. It prevents neuronal apoptosis. So it could be that in addition to the positive effects of normalizing glucose levels, we're seeing maybe one of the pleiotropic effects of the insulin itself. I think everyone should consider normalizing blood glucose levels after long, complex endovascular aortic procedures, and maybe even after open thoracoabdominal aortic procedures. The one risk of normalizing these glucose levels is hypoglycemia, but if these patients are very carefully followed in the intensive care unit, and you don't lower the glucose levels too much lower than 120, I think that it's a fairly safe and easy, effective therapy.